The function of the menisci is to evenly distribute weight across the knee joint and provide a cushioning effect which decreases stress in the joint. The menisci are able to move forwards and backwards during flexion and extension to maintain articulation between the joint. They also need to be able to move a little during knee movement to prevent themselves tearing. The menisci are shaped in a way that complements the shapes of the articulating surfaces of the bones. If the menisci are removed, we can see that the surface of the tibia, the tibial plateau, is flat, as the name plateau suggests. And if we add the femur back into the image, we can see that the articulating surface of the femur, the femoral condyles, are convex. As we can see as we move the image of the knee joint around a little, there is not a congruous articulation of the bones alone due to their shape, so there's a space that you can see between the bones, here and here. If the menisci are added back into the image, we can see they close a space between the bones. And if they are isolated, so the bones are taken away, we can see that they are concave superiorly. This creates a space for the femoral condyles to rest, and they're flat inferiorly, which allows them to sit on the tibial plateau. Now let's have a look at the cruciate ligaments and their function. If the bones are added back in, so we can have a full view of the knee joint. The cruciate ligaments prevent forward and backward movement of the femur on the tibia, and in that way they act to stabilise the joint. If we remove the femur and we look at the joint from the lateral side, we can have a good look at the anterior cruciate ligament. We can see how the anterior cruciate ligament prevents the femur moving backwards on the tibia. The femur is attached at the top here, and therefore is unable to move backwards from the tibia. This prevents anterior dislocation of the tibia on the femur. If we move around to the posterior view and remove the most posterior meniscofemoral ligament so we can clearly see the posterior cruciate ligament, we can see how the posterior cruciate ligament would prevent the femur moving forward on the tibia as it anchors the femur in place at the back, and therefore this prevents posterior dislocation of the tibia onto the femur.